watching. We don't have a lot of details, but there seems to be a situation in Minneapolis this morning, and an active shooter situation. And so we want to just send our prayers up for anyone who is involved, and of course our prayers for law enforcement who may be headed to the scene or at the scene here this morning. Thank you to everyone in healthcare who may be asked to respond as well. So thank you so much. Look, there are few issues more important to me than ensuring that all Minnesotans have access to affordable health care. I know the folks standing alongside me and behind me can say the same, and that's why we're here today, to stand up against the so-called big, beautiful bill that made the deepest cuts to health care in American history. This is incredibly personal to me. Many of you know I've told my story of growing up in a mobile home park to a single mom who at times in the history of our own family we didn't have access to health insurance. So this is a deeply personal topic for me. I worked for 22 years in 2 healthcare manufacturing companies before I ever stepped off the sidelines to run for Congress. And so coming to Congress, one of the objectives that I had was to represent my constituents and to try and get access to health care for as many people as possible. I'm not going to sugarcoat it. Because of these cuts, too many Minnesotans will lose access to the health care that they desperately need, and even more are going to see their health care costs go up. The latest estimates put 140,000 Minnesotans in jeopardy of losing their health care coverage. Let that sink in. 140,000 of our neighbors. And right now, when you think about it, it's not that folks aren't going to come to the hospital when they need one. These healthcare facilities have a responsibility to serve our community when they're sick. It's just going to be uncompensated care that actually happens when we could be delivering preventive care that actually lowers the cost of health care in our country. I've always said that it's too expensive to be sick in this country, and that has never been more true. Having served on the leadership team of a major Minnesota healthcare company for years, I know that preventive care not only saves lives, but it saves money. Somehow that is lost on my Republican colleagues who voted to pass a bill that will take health care away from millions of Americans and skyrocket the national debt, all to pay for tax cuts. The majority of the tax cuts in this bill went to the top 2% in our country. Literally think about what they just did, that I voted against, by the way. They took the lowest 10% in our country, income earners, and they cut Medicaid, and they cut supplemental nutrition. Food, nutrition is health care in our country. And they delivered that benefit and value to the top 10% in our country. It doesn't make any sense. We should focus on cutting taxes for the middle class in this country, but that's not at all what my colleagues have done. Prior to their passage of the big ugly bill, I will not call it beautiful anymore, working Minnesotans relied on the Affordable Care Act premium tax credits to help pay for their coverage. Those tax credits are set to expire this November. And when that happens, health insurance premiums will increase for everyone in the marketplace. Let me be clear. When folks get their premium increases, I don't care if you're on Medicare or if you're on a private health care plan. I am telling you now that your health care costs are going to go up. You're going to be asked to pay more because the market is already starting to prepare for what's about to happen in $1 trillion in Medicaid cuts in our country. Over 143,000 Minnesotans rely on Medicare for coverage, and 90,000 rely on the premium tax credit. 90,000, 62% of Minnesotans enrolled through Medicare will see their costs go up in 2026, with premiums increasing by $177 per month on average for everyday Minnesotans. Those bills add up. And I want to give you an example. This is really insane when you think about it. Prior to the ACA tax credits, which I was proud to vote for, and I'm on a bill to extend those tax credits, I know a farmer in this district who paid on Venture $28,000 a year in premiums for just him and his wife. He and his wife. Now they pay around $5,000 a year in premiums. That's an extreme example, but we're talking about people who grow our food and our fuel in this country who are being asked to pay that kind of money for health care in our nation. You may have heard the talking point from my Republican colleagues, those same Republican colleagues who won't show up to do town halls in their own congressional districts, that the current eligibility requirements for Medicaid aren't stringent enough to prevent freeloading and fraud. But let me set the record straight. Their bill is designed to increase burdensome requirements so that thousands and millions of people are kicked off their health care. Ironically, access to health care is the only way that many Minnesotans with disabilities, chronic illnesses, or mental health challenges are even able to work, but Republicans won't talk about that part. Let me say it again, because we can't stress the point enough. This is all happening to fund tax breaks for the top 10% in our country. And if you're in the top 10%, that's amazing, awesome, great for you. Pay your damn taxes. That's awesome. I'm pro everyone having an opportunity to be successful in this country. Working and middle-class Minnesotans, though, will die because President Trump and my colleagues in Congress, including the 4 representatives from my own state, are more concerned with lining the pockets of billionaires than they are with taking care of the people that they represent. I have often been named as one of the most bipartisan members of Congress, but I've often also been called a bit of a hellraiser because I will say things and do things that aren't exactly politically correct, even within my own party. But I'm going to always tell you the truth. And the truth is that this bill will raise the national debt by nearly $4 trillion over 10 years to pay for tax breaks for billionaires. So much for the party of fiscal responsibility. But I will tell you that I will not be quiet. I will not stand aside. I am going to be front and center in telling Minnesotans that your health care costs are going up because my Republican colleagues don't know a damn thing about health care in our country. The most correct thing that President Trump ever said was that health care is complicated. And if you remember, this is the same president and Republican Party who tried to repeal the Affordable Care Act over 60 times before I got to Congress. That is one of the reasons I ran for Congress, is because I will not stand as someone who didn't have health insurance in my own family at times for what they're doing to our nation. I'm not going to step aside. I believe that healthcare is a right, not a privilege, and that's why I will do everything in my power to make sure that Minnesotans are able to access and afford their health care. That's going to mean working with local and state elected officials, healthcare professionals and advocates. It's going to mean working with nurses unions in our state and in our country who will stand up for the patients that they serve every single day in hospitals just like this. It's going to take every single one of us to guarantee that mothers and fathers and family caregivers like Carrie, who's with us today, have the support and resources that they need to continue to serve their families and provide life-saving care. Now is the time to step up and fight back. And I would ask every single Minnesotan to call your representative, to tell your Republican congressmen and women to extend the Affordable Care Act tax credits, to roll back the $1 trillion in Medicaid cuts in our country. Because if there's one thing I know as a mother, and more importantly, a grandmother of 3 little boys, that there's nothing more important than the health and safety of our families. So thank you again for being here today. I'm so honored to have these amazing advocates standing behind me, and I have the pleasure of introducing a tireless advocate for Minnesotans in District 41, where we stand, State Senator Judy Seeberger. Thank you again.